We want to make sure you know everything you need to know before you leave your appointment today. First, make sure you have all the right contact information on your phone. Our office number is 913-888-0331. The customer service team is off-site. Sam and her team answer the phones, and the patient support team handles emails and electronic requests. Please remember to always use the phone for time-sensitive requests. Please enter my email address into your phone, drjohnson@aspirehealthkc.com. Email is used for administrative questions and things that are not time-sensitive. Please keep in mind that I don't have a nurse and the staff is not medically trained. Nurses are not generally trained to help with a naturopathic practice. Emails are great for general requests and questions, but medical questions are not appropriate for email. That means that if I need to open your chart, read it, and make a note, email's not a good way for me to manage it. If you need to talk to me about your case and it's just a quick question, the phone team will book you for a same-day 10-minute consult whenever possible. This is really there for you to make sure that you get my 100% attention to your question. If it is a medical question, I need to read your case and make notes so I remember everything that's relevant. Right now, you should have an email from HealthWave. So there will be links for some supplements if you have any special orders or if there's anything that you need to be able to order from home. There's also a message attached to this email, and it explains what I want you to do. I really like this system because it's web-based, and that means you can't lose it. You can open it from anywhere and any device, but sometimes your pop-up blocker might prevent you from utilizing the system. If that happens, go ahead and tell the office staff right now so we can fix it. We'll just send it to you in another format. So please check your email right now and make sure you're able to access the email with your program so that you can get started right away. If you get home and you realize that you don't have everything you need, you can send an email to that Dr. Johnson at Aspire Health KC address, and you will receive an email with that information shortly. You can buy supplements here in the office if you need to, or you can order them through HealthWave. So HealthWave is not just buying online, you're actually ordering it from the distributor. So this is a quality controlled order. You're not having to worry about whether or not it's a real product versus something that may not be as labeled or may not have been stored according to temperature requirements. If we talked about a compounded medication today, please keep in mind that compounded medications are not usually covered by your insurance. That doesn't necessarily mean that it's more expensive than what you're getting, but it may not be covered by your insurance. Your doctor usually cannot do anything to pre-authorize that coverage. Consider filling your prescription at a compounding pharmacy that processes insurance. The Stark Pharmacy at Menorah is the only one that I know of that does help with the insurance. Please plan to pay for that compounded medication. If you don't get coverage, you should still try and see if you can get that taken care of. If you have a recommendation for a prescription, that's going to go to your primary care doctor. Please help us by telling them to watch for a fax or communication from us. So if you could right now pause this video and call your doctor, whether it's somebody that I have communicated with before or a new doctor that I'll be contacting for the first time, I would appreciate it if you would leave a message on the nurse's line and say, I just had a visit with Dr. Alicia Johnson about summarize your symptoms in one word. She's sending a recommendation for me. It is something that I would like to try. She'll send you the information. Please call me when you get it. I'll check back in 2 days. This just makes sure that everyone is in the loop and knows what's going on. Sometimes if we send a recommendation to someone that's never seen one before, they might just wonder what they're getting. So this way you keep them in the loop. You need to have a primary care doctor. Even though any licensed naturopathic doctor is trained in primary care, I do not practice as a primary care provider. I don't provide urgent care, emergency care, but I do want to help if I can. So colds, coughs, stomach bugs, rashes, viruses, and other common ailments are very easy to treat with herbs. If your case is an exception, I need to have someone else to pass you on to so that I know you're getting care. The best scenario is to work with a doctor that I can contact easily to collaborate with them on your care. If you need me to be your advocate, I am more than happy to do that for you. Many of my patients see Stephanie Revels for primary care. If you want a primary care doctor that's open to holistic treatments and willing to collaborate on your care, consider calling her. If that's what you want to do, you can go ahead and pause this and call her right now. The number is 913-451-9889. You can tell them, I'm a new patient with Dr. Alicia Johnson, and she recommended that I establish care with Dr. Revels as a primary care physician. She will know what to do when you tell them that, and they will book you accordingly. If you're looking for an OB, I really like Dr. Janetta Proverbs. Her number is 913-642-7000. Again, you can pause this, call right now to make an appointment. She does take a while to get into, so I would suggest that you go ahead and establish care. You can tell them, I went to establish care with a well check with Dr. Proverbs as a new patient. Aspire Health will have its own podcast coming soon. You may also like the podcast available on Pilates 1901 website. If you're sick or in pain, there may be a lot that I can do to help. So please think about calling the main line and ask for a same-day appointment if you need help. The appointment can be done over the phone in some cases. I'll refer you to urgent care if I can't help or if I think you need immediate attention. I will contact your primary care doctor if needed and tell them that you need help if I think we need to involve them. Please feel free. Things like back pain, vomiting, sinus infections, ear infections, anything like that, keep in mind that I will make time if it is possible for me to make time. And oftentimes there can be a really simple answer. You may have labs for Quest. If you want to know if you have coverage for labs, pause the video, call your insurance company and say this: what is my policy for lab coverage? If they start asking for codes and provider numbers, ask them just to give you your general coverage information, and that should tell you what you need to know. It should sound something like this: you have full coverage if you go to Quest, that's a common policy, or you get 80% coverage of the negotiated amount after you meet your deductible, something like that. It's a little bit less straightforward, but it still tells you most of it's going to get paid for. So if you have a lab order, please pause the video and schedule your lab draw through Quest. You can find a link on the desktop to connect you with Quest locations. You can easily schedule online, and you can also call. So we'll also call you with a reminder to tell you to have your labs done, but please go ahead and think about scheduling this ahead of time so you don't forget. That time can go by really quickly, and it's very important that you do follow-up testing to make sure everything is being managed properly. If your labs require a mobile phlebotomist, please go ahead and give Jason a call. This is the phlebotomist that we use. His phone number is 816-589-1228. So he can usually see you same day, next day. He does a great job, good with kids. Remember to be hydrated if you're having a blood draw. And if you're having a food allergy test done, then this is the person that you're going to contact. If you would prefer to have a mobile phlebotomist come to you so that you can work your labs into your schedule, for example, if it's difficult for you to leave work, please take down Jason's phone number. He does a great job. He can come meet you anywhere and do the blood draw. If your labs require a urine, stool, or saliva test, read the directions now so that you know how to prepare. You can find additional videos about the specific tests on this YouTube channel, so I'll answer those questions more specifically later. Special requests about labs, including reorders, records release, copies, those are usually processed on Thursdays. If you want something like that urgently, generally we're going to charge a $30 priority fee. You can always request these things at the time of the visit, and we really go out of our way to try to make sure you have everything when you leave. So sometimes those simple requests, when they're rushed, can be a bit of a challenge for us to manage, and that's why we really encourage you to do it on Thursday. If you need something, get in touch with us via email. That's the best way to do it. If you want to get updates on your Facebook page, go ahead and like Dr. Alicia Johnson, ND. I use this for posting recipes, special events. A network of other people who are interested in natural health will be available to you, so you can kind of share ideas there. Also, my weekly blogs are posted on the Facebook page, and I really make an effort to go into more detail about your condition so you can learn a little bit more. Please feel free to post questions about topics that you want to know more about. I do read that, and I do use those questions to write my next blog. You can also go to aliciajohnsonnd.com and click on blog to subscribe. A couple of other suggestions. I'd like for you to go to the App Store and consider adding any of these apps that may help you with your program right now. Think Up is something that you can use to help you with your goal setting, to help you with motivation. I think this is a great, simple one to use. If we're working on hormone issues, then think about downloading something like Period Tracker so we can track cyclic symptoms and really keep some detail. This can help a lot, especially as you try different things. I keep notes, but you can keep even more detailed notes on what's working for you and what has the biggest impact on your symptoms. MyFitnessPal is a good app for keeping track of your dietary goals. Glenn Harold has an app. It's not free, but it's inexpensive for self-hypnosis. And some people really like his programs for things like quitting smoking, overeating, insomnia, stress, anxiety, depression. For payment, we do keep your card securely on file to process remote payments as needed and with your permission. You're always emailed automatically when you're billed for anything. We do this because we sometimes do phone consults or send you supplements. It helps us keep track of everything so you don't have to give us your card every time. At the time of the visit, you're always welcome to present us with a payment or simply ask for the card on file to be used. Regarding your supplements, you'll continue your supplements until your next visit unless I give you a specific time frame. So many of the things that you're starting right now will not be your long-term plan. They're just to get you feeling better right now. So you will continue what you're doing until we follow up again, but this probably is not what you'll be doing forever. What we try to accomplish is getting you feeling better right now and then find out what we have to do to maintain that, which often looks very different. I do acupuncture. I will see you for same-day acupuncture visits if you're in pain or if you really need something that day. So if you come in for acupuncture, you can expect to be here for an hour. I'll be with you for the first 10 minutes and then you just stay and relax. You should consider bringing headphones to listen to your own music. Otherwise, we have various meditations, white noise, and music that you can listen to. Please take a minute to pause the video to schedule your next visit online, or you can schedule at the front desk when you check out. If you want to schedule online, you can go to aspirehealthkc.com and click book your appointment. You can go back in the same way to reschedule if you need to later. You won't be billed when you book the appointment. You do enter your credit card information or provide your credit card information when you schedule your first visit, but you don't need to be billed when you actually book the appointment. But please make sure you cancel within 24 hours if you need to cancel or reschedule. We do charge for appointments that are not canceled within 24 hours. Visits are always booked for 45 minutes when you need a follow-up, whether it's on the phone or in person. That is the amount of time that I require to make sure we go over everything in enough detail. I do always leave time for quick 10-minute consults. For me, a 10-minute consult is one question. For example, I recently started having stomach pains. Does this have something to do with my new diet? If you have a simple single question, then that is appropriate for a 10-minute check-in. The rest of the time, I really want more time. I like to make sure we have plenty of time to go over everything in detail. Remember, make sure you cancel within 24 hours if you need to. If you have multiple family members, please book a visit for each person so we have enough time. Make sure that you have a separate visit booked for each person. We may not need a full 45-minute visit, but I do prefer to make sure we have more time rather than less time, because I don't like to rush you when you still have more information to give me. The visits are always booked for 45 minutes. If you are booking more than one family member and you have special circumstances, that's fine. We'll address it. But please book the time anyway, because we don't want to run out of time. Labs are usually repeated after 3 months until you're doing better. After that, labs are repeated once per year. I make sure you leave with a lab order every time. So typically that first lab order is for right now, and typically a lab will be drawn again in 3 months, and then once you're in a place where you're happy with how you're doing, then I always recommend that we repeat once a year. So that means that if you leave in March and you're coming back the next year in March, I'm still going to give you the labs now to test next year. We do our absolute best to follow up on everything and make sure we follow through. We often take on the role of coordinating with others to make sure you get what you need. That means that you may hear from Bev, Sam, and Taylor after your visit. Bev, or the patient support team, checks in after every visit to make sure you're taken care of. Taylor follows up on anything that requires coordination with us and other offices. And if you need help with another office or provider, you can just let us know, and we will do what we can. Please keep in mind that we do our best to help make sure everyone involved in your case is following through on what they're supposed to be doing. Sometimes you may have a situation where the ball has been dropped by someone, and so we do take on the role of trying to research that for you and trying to figure out what happened. So typically, if something like that comes up, we're just going to get as much information as we can from you so that we can find out where the problem happened.